Hello and welcome to A Deadly Silence. I'm your host, Larry Curtis, and it is the goal of all of us associated with our program to bring you current and educational information associated with the alcohol and drug epidemic, not only here in the city of Brockton, but throughout our South Shore community. Today, our special guest is Dr. Hossain, who is Medical Director of Special Care Nursery and Chief of Newborn Services at Good Samaritan Medical Center here in Brockton, which is part of Stewart Healthcare. Dr. Hossain, welcome to our program.
Thank you for having me on the show.
It's a pleasure to have you. I think tonight's episode is really special for our program because while we've always talked about substance abuse, alcohol addiction issues as it affects the family and loved ones or even the addict themselves, tonight's episode we're going to be talking about the impact of substance abuse during pregnancy. I welcome you to our show, and would you start off by telling us a little bit about your background?
Sure. So I am a pediatrician and also a newborn baby specialist or neonatologist. I trained in Boston at the Floating Hospital for Children at Tufts and came here to Good Samaritan in 2000. And from 2010, I'm the medical director of the Special Care Nursery as part of the affiliation of Boston Children's Hospital with Good Samaritan Medical Center.
So is your program part of the Good Samaritan, or is it really a children's hospital?
It's really a children's hospital run
managed,
program.
Managed by, at Good Samaritan
At Good
for
Samaritan.
the patients that we have here in the South Shore area. Okay.
Yes, it's for, in fact, all the neonatologists, all the backup here are from Children's Hospital as part of a team. Right?
Okay. And phenomenal job that anyone affiliated with Children's Hospital does at any of our hospitals.
Thank you so much. We think,
we don't think, we know. That's the difference. You are very successful. We appreciate that very much. How'd you get involved in this type of situation?
You mean newborn medicine?
Yes.
Yes. In fact, during my residency in pediatrics, that was my first rotation, and I fell in love with it. I mean, I am at heart a geek, and I like the technological aspect of neonatology, and it was challenging, satisfying, all rolled into one, so you couldn't really ask for more.
During that residency period, was substance abuse part of the experience that you had the opportunity to deal with?
No, I mean, I did my residency in 1992 to 95, and newborn or drug withdrawal in newborn babies was, I'm sure, quite significant at that time too. But I don't recall taking care of too many babies who were withdrawing. As opposed to now, it's almost like an epidemic. It's like every other day. Or simultaneously, you're taking care of multiple babies with withdrawal from drugs.
Now, at Good Samaritan, they have a maternity ward.
Right.
So basically, from the standpoint of a mother coming into the hospital, you're going to know from just the medical history of the mother that you've got a potentially at-risk baby. That is
absolutely.
So kind of walk us through kind of that admission process and ultimate delivery, and then we'll go on to the care.
So ideally, it's a patient who started having her prenatal care at one of our local OBGYNs or midwives, and actually at Brockton Neighborhood Health Center, they have excellent midwifery care that provide services to pregnant women.
Service and guidance.
Right. And hopefully, they have already gone through all the history taking, getting a sense of what are the risk factors and things like that. So when they come in, we already have information. Now that's going to be probably, I'm going to say maybe 3/4 of the time. The other 1/4 is going to be a patient who never really availed herself of the services for whatever reason, and most of the time it is to hide the fact of their addiction. Drug addiction, exactly right. And we have a good sense of picking up on red flags, and that basically will prompt testing on mom. Of course, for mothers, they usually consent to it, but sometimes they may not. Then we don't have a choice. We will have to do it afterwards on the babies, right?
In relationship to social service aspects, I know that whenever there's any child that's at risk, that
Right.
as a caregiver, there's a responsibility of notifying social service agencies, for the ultimate safety of the child in the
Right.
end.
Right.
Is that something that, is there a privacy issue there, or is that something as a caregiver that you are required and mandated
We
to
are
do?
mandated by the by state regulation to report drug addiction or drug withdrawal in newborn babies. So we don't make any exception because they have a lot more information outside of the hospital. We don't have that information, so we can make decisions.
So as a caregiver, you're mandated. You make the reports, and then
Right.
in this case, after a birth,
Right.
The social service agencies would come in and
Do
do
an
their due
investigation.
diligence.
Absolutely.
From that perspective there.
Right,
Okay.
correct.
So 75% of the patient population, or the pregnant mothers that you're dealing with,
Right.
are coming in. They probably have had proper screening,
Right.
and hopefully some continuing education as
Absolutely.
to why to stay off of drugs. Are they off drugs at that point in time?
No. So what happens, the ideal situation is that if you have an addiction and they would try to change over to a medication that's acceptable during pregnancy, and ideally you would start it before you even get pregnant. So you would be in a management program, habit management program with counseling and everything, and that would be the ideal situation. But sometimes, mothers, when they find out that they're pregnant, they seek help.
Right.
And then they are changed over to something that's
So
safer.
So
during
it's
pregnancy.
similar to if an addict is using a drug,
Right.
and they may be in a recovery mode, but maybe like a Suboxone is kind of a alternative to the actual drug itself.
Exactly.
To help them in that
Right.
type of recovery
Right.
aspect.
So rather than
Yeah.
heroin
Yeah.
off the street, which you have
Right.
no idea what it may contain, you put them on either methadone or Suboxone, Subutex, something
Okay.
like that. Yes.
Okay. So as those 75% that are getting the appropriate care and treatment and guidance, they're admitted to the hospital. The due date
Right.
is ready.
Right.
Walk us through that process.
Right. So
Yeah.
they won't. They are not going to be treated any differently. So everything is in place, and whatever medication they were getting, they will continue to get that. And if it's an induction or if she comes in natural labor, whatever, the process is going to happen. And after the birth of the child, then obviously we will confirm with the toxicology screen.
Right.
And then, of course, depending on what kind of medication or what kind of substance abuse we are dealing with, we will start evaluating baby at certain interval, right? And that's how we come to a conclusion whether a child is actually withdrawing or not.
That's right. So, in essence, that child is potentially born with an addiction at
Right.
that point in time.
Absolutely. So depending on what we are dealing with, and specifically now that we are dealing with such a big problem with a narcotic addiction, I'm going to stick to that for now and say that, depending on what you are dealing with, they can show symptoms after a day, 2 days, 3 days, to as late as 2 to 3 weeks later. So you have to watch out for those.
So as the baby is now, entered into the healthcare system, you're monitoring the level of addiction, and how is a baby monitored from a withdrawal aspect, or what's the time frame, and what's the process?
Very good question. So we do, for narcotic addiction, we actually have a tool. We call it neonatal abstinence scoring tool. Okay, and it was the one we use at GitSam is called modified Finneran, and this physician actually developed this tool in the 70s, and it looks at multiple signs and symptoms. Some are specific to narcotic withdrawal, some may be common to just a fussy baby. But overall, when you do this, when you're looking at all these signs and symptoms, every one of them has a weighted score. And based on the score and consistency of the score, you have a good sense of whether the child is winning or not. Now, in terms of timing, which is very, very important because methadone is very long-acting. Babies rarely show symptoms after birth. It usually is 48 to 72 hours to up to 2 weeks. As opposed to, say, heroin off the street, almost always they withdraw within the first couple of days or so, sometimes later on. And of course, you have in between, like Suboxone, they may withdraw 4 or 5 days later. And that's why, we watch them for at least 5 to 7 days before we actually discharge them.
Which kind of is going to lead me into a kind of a quick follow-up question, because in today's world of insurance, reimbursements to the hospital, I mean, how much of a drain is that on the resources of the community hospitals, in this case here, in relationship to what, if there's an addict, there's a higher probability they're not an insured patient population, and obviously the expense associated with that level of treatment and length of stay has to be fairly astronomical for the organization.
It is. In fact, there was a study done in 2000, published in 2012 in the Journal of American Medicine, and this gentleman, Dr. Stephen Phillips, he actually looked at not just the length of stay, but also at the cost of treating these babies. And also, as you brought up the issue of insurances. And what he found is that obviously it takes us a long time to detoxify a baby from drug addiction. And we're talking about average of anywhere from 2 to 4 weeks in hospital. And the costs are going to be astronomical. It's going to be in the thousands of dollars. And unfortunately, as you rightly pointed out, more than 75% in this study was Medicaid.
Okay.
Right.
So that, and the Medicaid is a drain on all of our services,
All of
our
us.
tax base,
Absolutely.
from that perspective there.
Exactly
you
right.
know. And in the healthcare environment, there is only so much of reimbursement associated with each of the different levels of the cases, that are there, obviously. What happens in relationship while the baby is going through the detoxification aspect, its length of stay? The mother, whether it was natural childbirth or C-section of that matter, typically would be discharged in 2 days.
Right, 2 days or 4 days, right.
2 to 4 days. So what happens in relationship to any follow-up care from the mother's perspective?
Right.
We understand social services is already involved because you've got a mandate to identify that.
Right.
But from the standpoint of a healthcare perspective, my baby's in that hospital for 2 to 4 more weeks. What's happening from the mother's perspective?
Very good question. So, if a lot of times this is going to be a mother who, for her reason or because of the medication that she was abusing or not being able to give up, she's not going to be breastfeeding. And the way our hospital system is set up, at least here in the Brockton area, we only have limited number of resources or rooms. So we can't really put mother in a room for the next 3 to 4 weeks.
Right.
But they are not. I mean, the vast majority of time, we encourage them to come in and spend as much as they can taking care of their own baby, and most do so.
So when we're talking a special care nursery, I've worked in healthcare most of my life, so I have a little bit of familiarity there.
Right.
We're talking kind of more of a generic open landscape where there are multiple cribs or bassinets or things of that nature, and basically the mother is really going to be sitting in a rocker potentially next to that bassinet or that crib for pretty much the length of stay, from that perspective,
Right. So it's we do it a little bit differently because what we try to do is if the baby is sleeping, then basically we tell mom that, if we provide you a room, You can rest there. When the baby wakes up, we will call you. You can come, and that's typically what happens. But sometimes, as you pointed out, they're sitting there holding the baby for a while. It is tough. Right.
So we've got the addicted mother giving birth, babies going through the detoxification process now. The mother's probably receiving some additional social services because of the mandated reporting aspects of it. What's the reaction of the staff? I mean, it has to be some very special people from the physicians, the caregivers, and so forth to be able to see this day in and day out. What assistance do they have in relation to that type of trauma? I mean, to a certain extent.
Right, and it is very difficult taking care of a baby who is being detoxified or detoxification process or withdrawing from drugs. And the hospital has always provided, as in any a trauma situation or stressful situation, you're always welcome to get help for counseling and stuff like that. But my nursing staff, they have been doing it for a long time, and ultimately it will get under your skin, but they're very good at taking care of themselves, talking with each other and sharing with each other. And but the main thing is, what we try not to do is we try not to judge anyone. So whatever you're feeling, you keep it inside, and then you talk
out amongst
yourself, but we don't necessarily involve that in patient care.
So it's positive reinforcement and peer support,
exactly,
coming within your own group from that perspective as well.
Because sometimes you can have more than 50% of your babies who are withdrawing, and that is a very stressful situation.
How large of a unit is your specialty?
So at Good Sam, it's a 10-bed unit, and we have had sometimes as many as 8 babies.
Okay. Right. Is this particular unit specific to the Good Samaritan facility here in Brockton, or are there similar units in other healthcare organizations?
No, yes. In Brockton, we also have a level 2 nursery at Brockton Hospital. And I don't have much information from there because it's a
so that level of care is available in other healthcare organizations out there as well, given the geographics of the patient population that you're dealing with. Let's look at the aspects of aftercare. The baby's gone through a detoxification process, is discharged. Has there been any studies to indicate or follow up as to what happens in the first 5 years of that child's?
So we are, for some of them, we do have a lot of data. And specifically, we are talking about fetal alcohol syndrome or fetal alcohol effect because that has been around for a long, long time. There are many studies looking at addiction from narcotics and cocaine. Cigarette smoking also has extensive studies done. But some of the other ones, like the antidepressants, the PCPs, not enough patients, not studied long enough. But certainly, there are studies looking at long-term, short-term and long-term effect, and definitely there are detrimental effect, long-term effect for some of these babies.
Okay. Educational-wise, has there been, the brain, I mean, how does the brain develop in relationship to that, and has it, will it affect that child during its growth years?
Right, so if you take fetal alcohol effect or fetal alcohol syndrome and mental retardation or neurodevelopmental complications are fairly common. Now, if you take narcotics, unfortunately, it's not as clear-cut because of other variable in it. Because most women doesn't necessarily just do one drug. They may do 2 or 3. They may drink at the same time. They may also smoke. And all this makes it very complicated to figure out what is causing what effect. But certainly, people have looked at these children as they're growing up, and they have had language issues, they have had school issues, intellect, all of them, some of them has shown, a long-term effect in babies who are born to mothers with substance abuse.
Okay. As the chief of newborn services, what do you find is the more difficult aspect of a mother coming in with an with an addiction problem for her newborn?
Right. Taking care of the baby. That's the hardest part. I mean, you have to follow them for a period of time until they consistently show you signs and symptoms that makes you feel confident that this is a baby who is withdrawing from drug addiction. And then you can actually start treatment. And then you basically, once you have captured them, then most of their signs and symptoms goes away. It's much easier. But the first day or 2 or 3, depending on how long they have been showing sort of like little signs and symptoms, these are very, very hard to take care of babies because, generally speaking, these babies are in a lot of distress. Mm-hmm. They have problems with feeding, vomiting. They have problem with sleeping. They don't sleep. Crying, especially, some of these babies have such high-pitched cry. It literally goes straight through your heart. It's very difficult. So,
part of the pain of any loved one that is dealing with an addiction, a member of their family that's addicted, is the death of a loved one through
Absolutely.
the addiction process.
Right.
Is there an element of death associated with this
Right.
Pregnancy addiction issue?
Absolutely. So depending on how long you have been addicted, what kind of drug you have been misusing, certainly a lot of them causes miscarriages, late fetal demise, stillbirth, abruption, that puts babies at jeopardy. They can have many other complications during pregnancy.
Far more higher due to the addiction issue than a typical pregnancy aspect.
Absolutely, and especially with cocaine, especially with other, drugs of addiction. These are fairly high-risk pregnancies, right?
Is there, and it may not be you may not be able to answer the question, but is there any legal aspects of endangering that baby's life as a result of the death to the parent? That's a tough question.
That's a loaded question. And in the state of Massachusetts, as far as I know, there is nothing.
Okay. So it's looked upon as an illness. The addiction is an illness in the context of the pregnancy.
Course of your illness is the complication.
Right.
Mm-hmm.
From that perspective. There.
Right.
Okay. What do you find most enjoyable about your job?
Not necessarily just dealing with babies who are withdrawing, which by itself is very satisfying. Once you have a baby who looks and acts like a real baby, but most of my patients are premature babies or other term babies who are sick. And unlike adult population, the vast majority of these babies will get better. We will make them better, and they will go home healthy. And that is very, very satisfying.
Very rewarding.
Very rewarding.
For yourself, your staff,
yes,
all the clinical caregivers inside
absolutely.
there. To see a family member come in and
very rarely will you have a bad outcome. So
that's a warm, comforting feeling, isn't it? Makes all those years of studying
worth
and
it.
residency and well worth the time and
it.
energy.
Yes.
That's fantastic.
Yeah.
What would you say through your experiences with the pregnancy addiction issue to the mothers out there? I mean, what message would you give to them out there?
So there are a number of issues involved here. I mean, some of them realizes that they are in trouble and they will seek help, and I will tell them that there are a lot of services out there. Brockton Neighborhood Health Center is one of them. They have a very comprehensive care for patients who are past substance abuser. Mm-hmm. And there are other services too, and you should really do it not just to help yourself, but your unborn child. There will be some, unfortunately, who may know about all the services available, and they will somehow, elude the system. And I will tell them that at least think about your child, if not yourself.
If not yourself, sure.
Right, and get help.
Yeah.
Right.
You know. Tell us a little bit about the Children's Hospital affiliation, and how that manages that program.
Right. So from 2006, all the special care nurseries and neonatal intensive care units in the Stewart system, so specifically
The Stewart system is the old Caritas Christi, the old Catholic hospital system.
Absolutely.
Going way back.
So all of them are St. Elizabeth's, Holy Family, and Good Sam. We have level 2 or level 3 NICUs, and at that time, Caritas initiated the affiliation with Children's Hospital, and Stewart. Subsequently, when they took over, they have continued with that affiliation, and I think, it's a two-way street. We provide outstanding care, I believe, and I think Stewart appreciates that, and it's been.
Well, you won't find a better children's hospital than our Boston's Children's Hospital here, and I'm sure all the medical staff associated with it are bringing that excellence into the Stewart system in these special care nursery areas from that perspective.
Absolutely.
And I think you get a consistent theme of how that care is going to be administered, the guidelines and so forth.
Absolutely, and not just the management and stuff like that. You're also talking about transferring patient from a lower level hospital to a higher level hospital, and they provide outstanding transport services.
So that when an infant is born and an addiction problem, and it may require more intensive care, then it's going to get that transfer into the Children's Hospital in Boston, where that skill level is as good as it is in the community hospitals, but needs that little extra push.
Right, and fortunately we have never had to do it, but the option is always there. We also have the higher neonatal ICU at St. Elizabeth, so we have many different options of depending on what is going on with the baby and where we transfer that baby, but everything is in place, so guidelines and everything.
We've got time for maybe one more question, and we're going to wrap up here real quick. How important is it to the mother for the family to stay involved in that care?
Very, very, very important. Absolutely. That's always our aim, is to keep them together. And mothers who realize that they can still do so much for their own child, they will be provided with all the services. Exactly.
Beautiful. Well, believe it or not, we're near the end of our program. I told you it was going to go by real quick. I want to thank Dr. Hossain for being here with us.
Thank you so much for having
me. It's been an awesome opportunity to bring up the issues of substance abuse during pregnancy. And on behalf of all of us here at A Deadly Silence, thank you for joining us, and we'll see you in our next episode.
Thank you.